Hello, my name is Sydnee Franzwa, and today I'm going to be talking about my project on the beneficial outcomes of programs utilized at the Women and Children's Center of the Sierra, abbreviated as WACCS, which is where I completed my internship. At WACCS, their goal is to empower women to rise out of poverty. In order to do this, they take an individual approach and provide a wide range of services to women, including material items, classes, and other services that women need. I separated their offerings into three categories. Items include things like diapers, hygiene supplies, and food. Services include referrals for help and help finding jobs. Classes include ESL and Mommy and Me life skills. Now I will talk about the purpose of my project. My goal was to determine what services are providing the most benefit to the women that WACCS serves. Because they offer such a wide range of things, I hope to be able to find out what services were helping and benefiting the women the most. The first part of this project was conducting a survey. The survey included some demographic questions, rank questions for the services at WACCS, where they could indicate how helpful it was to them, and a few short answer questions where they could tell me what service was the most helpful to them and why. I also conducted two focus groups, one in English and one in Spanish. These were conducted during the Mommy and Me classes. The focus of them was to discuss with the participants what they felt was most beneficial to them. This allowed me to get additional feedback from their perspectives. Starting with the survey results, I ranked each offering based on the mean using the 1 to 5 scale, with 5 being most helpful. There were 47 total surveys that were completed, though respondents didn't use all services. I also looked at how many people did not respond to each category. The top 3 ranking services were ESL classes, Mommy and Me classes, and domestic violence services. In the survey results, there was little variability in the responses, with mostly very helpful or not applicable options chosen. Now for the focus group results. A prominent recurring theme was that diapers really help and are a reason women initially come to WACCS. With help and referrals, participants explained that they could come to WACCS to get the help they need. They also felt that WACCS was a place they could come to socialize with other women. From the survey, I concluded that whichever service a woman used, they felt that it was very helpful to them. There was a lot of not applicable responses, which decreased responses in each category, and there was very little variability, making it difficult to draw further conclusions. For the focus group, it was concluded that diapers were very important to the women and often brought them to WACCS. They also felt that WACCS was a safe place to come for the help they need and to interact and socialize with other mothers. As for limitations, one is that the sample size for those that use each service was small, and there was possible misunderstanding that impacted results. For example, one respondent indicated diapers is most helpful, but on the scale question selected it was least helpful. The survey was meant to be a comprehensive list of services, but this may have increased the occurrence of just selecting one number for all services. The focus group only had participants from the Mommy and Me class, which may not reflect everyone, especially in the socialization theme. For future recommendations, I would want to have a larger sample size, conduct one-on-one interviews to get feedback on what they find helpful and why, and conduct focus groups with women that use services but do not attend classes. In closing, while I may not have found a clear winner, it was evident that the services provided help the women in their lives based on their individual situation. They serve about 350 women a month and help them provide for their needs, as well as the needs of their children, and help them to rise out of poverty. I'd like to thank all the wonderful women at WACCS for all their help, including my preceptor, Pam. I would also like to thank my advisor, Dr. Garn, and Mel for instructing the class, and the Western Region Public Health Training Center for providing the monetary help to allow me to afford childcare so that I could complete my internship.